will be the patient's head, face, and neck. I would start out by noticing and inspecting the size, symmetry, and shape of the skull. While I'm doing this, I'm checking the scalp symmetry and movement of the scalp as well. Looking at the scalp for any lesions, areas of alopecia that would be worth for further inspection. I'll look at the patient's face for symmetry, size, and shape. I would check for any lesions, for any tenderness in the skin, any blemishes that would warrant further instruction or inspection. I would check the patient's sensation in the face with a wisp of cotton. I would check the patient's neck for symmetry as well as range of motion, asking to turn the head, look up, look down, and then roll the head to the side. Okay. I would also check the strength of the sternocleidomastoid muscle, inspecting for any jugular vein distension in the neck. I would also check the trachea. The trachea is midline, and I would palpate the lobes of the thyroid. I would assess the patient for TMJ, asking the patient to open their mouth and close their mouth with my hands on their mandibular process to assess any crepitus in the joint. And then finally I would auscultate the carotid bruit to see if there were any bruit. Assessing the patient's skin, hair, and nails. I would start by noting the color of the patient's skin, looking for any lesions or blemishes, checking texture of the skin, turgor, the hydration of the skin, and also the temperature of the skin, which is warm to the touch. Moving to the patient's nails, I would note the color of the nails, the patient's hygienic care of the nails, the thickness and texture of the nail's adherence to the nail bed. I would do that by placing my finger pad slightly under her nail and lifting up. I would do this on each digit bilaterally. I would also at this time check capillary refill, noting any cyanosis or clubbing of the fingers. And I would do this bilaterally as well. To assess the patient's hair, I would note the color and the quantity as well as the distribution, looking for any areas of alopecia, also for any lesions that would be present on the scalp at this time. Also looking for the distribution of the hair. For this segment, we're assessing the lymphatic system. We're going to start with the occipital lymph nodes, which are behind the ear, move into the pre-auricular and the post-auricular. We're going to check the superficial cervical lymph nodes, the posterior cervical lymph nodes, as well as the deep cervical lymph nodes. Move into the tonsillar, which are at the bend of the jaw, the submaxillary, and the submental. Assessing the patient's eyes, I'll begin by doing an inspection, making sure that the patient's eyes are symmetric and that there's no obvious inflammation or irritation that would need to warrant further evaluation. I'll start by palpating the patient's eyelids for any masses, areas of swelling, making sure to palpate the nasolacrimal duct for any hardness or exudate. I would then ask the patient to look straight ahead while I inspect the sclera, looking at the iris and the cornea as well, looking for any irritation, discoloration. At this point, I would check the patient's pupils and for light accommodation. Patient looking straight ahead, I'll move a light into the visual field, making sure that the pupils dilate from 5 millimeters to 2 millimeters. I'll also check the cornea for any opacities from the side. At this point, I would give the patient a moment to clear their vision. I would ask them to read a chart as well as to read a card, reading the bottom line to assess visual acuity. I would ask the patient to cover one eye and again read the lowest line that they could. I'm also doing this to make sure that the patient's eyes don't wander and that their vision remains focused. Next, I would ask the patient to uncover the eye to focus on the tip of the pen. What I'm doing now is assessing all the visual fields. I can do this in either an H pattern or a star pattern. I'll be demonstrating the H pattern. Have the patient look at the tip of the pen, not moving the head, only moving the eyes, to follow the pen into all visual fields. The patient does this appropriately. Next, I will get the patient to focus on an object on the wall and then quickly look at the pen again, and I'm checking for accommodation of the pupils as he again focuses at the wall and then on the tip of the pen. The patient does this appropriately. Finally, I want to check the patient's peripheral vision. To do this, I will reach behind the patient and ask him to let me know when he can see my fingers wiggling using his peripheral vision. Again, from the side.
Yep.
And the lower visual field.